Hello everyone, and welcome back to my video series over cognitive behavioral therapy. Today we will be looking at trauma and PTSD in CBT. Post-traumatic stress disorder, PTSD, is a mental health condition that develops after exposure to a traumatic event such as abuse, violence, accidents, or natural disasters. PTSD affects cognition, emotions, and behaviors. These lead to intrusive memories, hyperarousal, emotional numbing, and avoidance behaviors. CBT is one of the most evidence-based approaches for PTSD, helping individuals process trauma, reduce distress, and regain control over their lives. This presentation will focus on trauma-focused CBT and its core techniques, managing PTSD symptoms through cognitive and behavioral interventions, and addressing avoidance and emotional numbing. First, we'll look at trauma-focused CBT. TFCBT is a structured short-term approach designed to help individuals, particularly children and adolescents, process traumatic events in a safe and supportive way. It integrates cognitive behavioral technique with trauma-sensitive interventions. Some key components of TFCBT include psychoeducation, teaching the clients about trauma, its effect on the brain, and common reactions; cognitive processing, identifying and challenge distorted trauma-related beliefs, such as "it was my fault" or "I will never be safe"; exposure therapy, gradual exposure to trauma-related thoughts and reminders in a controlled way; relaxation and coping skills, which is teaching progressive muscle relaxation, mindfulness, and grounding techniques; narrative therapy, helping clients reprocess traumatic memories by creating a trauma narrative and gradually confronting painful details; and parental involvement for children, which is educating caregivers on supporting trauma recovery. TFCBT is highly effective in reducing PTSD symptoms, especially when implemented in a safe and structured manner. Managing PTSD symptoms can be grouped into four categories. Let me restart. PTSD symptoms can be grouped into four categories. We have intrusive symptoms, which are flashbacks, nightmare, and distressing memories. There's also avoidance behaviors, so avoiding reminders of the trauma. And then negative changes in cognition and mood. This is seen as guilt, shame, and detachment. And then the last category is hyperarousal and reactivity. So this is also seen in irritability, insomnia, hypervigilance. CBT interventions focuses on a few different interventions to help tackle these symptoms. One can be grounding techniques. So this can help clients stay present during distressing moments. A big example of this grounding technique is the 5-4-3-2-1 exercises. There's also the breathing exercises to help lower psychophysiological arousal. We have cognitive restructuring, so help identifying and reframe self-blame, guilt, and fear-based thoughts related to trauma. We also have exposure therapy, so encouraging clients to gradually confront trauma-related memories, places, or situations in a safe, controlled manner. We have the relaxing technique training, which is the deep breathing, progressive muscle relaxation, and guided imagery to counteract hyperarousal. By systematically addressing PTSD symptoms, CBT helps reduce distress and restore emotional stability. One of the biggest challenges in PTSD treatment is avoidance. Clients often avoid thoughts, feelings, and situations that remind them of their trauma. While avoidance reduces distress in the short term, it reinforces fear and prevents healing. Some strategies to address avoidance includes gradual exposure therapy by encouraging clients to face distressing memories in small, manageable steps, Behavior activation, we induce in enjoyable activities that trauma survivors may have withdrawn from. There's mindfulness and acceptance-based approaches, where we can teach the clients to tolerate distress without suppressing emotions. Then there's also cognitive processing therapy, helping clients examine how avoidance contributes to prolonged suffering and develop healthier coping strategy. Emotional numbing, where clients feel disconnected, detached, or unable to experience joy, is another protective mechanism after trauma. Techniques like self-compassion exercises, expressive writing, and reconnecting with social support helps restore emotional engagement. And while CBT is the gold standard for PTSD, there are other evidence-based treatments that can complement or serve as alternatives. We have prolonged exposure therapy is an intense form of exposure therapy that helps clients fully process traumatic memories. There's also eye movement desensitization and reprocessing, EMDR, which uses bilateral stimulation, which is the eye movements tapping, to help brain process trauma. And there's also SSRIs, which medication can help manage severe PTSD symptoms, but is most effective when combined with therapy. CBT is often preferred because it teaches long-term coping skills, is structured, and has strong support. So as we learn, CBT is one of the most effective research-backed treatments for PTSD and trauma, providing individuals with tools to manage intrusive symptoms and hyperarousal, strategies to reduce avoidance behaviors and emotional numbing, and gives a structured way to reprocess traumatic memories safely. Research shows that CBT significantly reduces PTSD symptoms and improves overall functioning, particularly when exposure-based techniques and cognitive restructuring are included. Helping clients regain a sense of safety, control, and emotional connection is at the heart of trauma-focused therapy. By using CBT, clinicians empower survivors to move forward in their healing journey. Grounding and relaxation techniques are essential for managing distress and symptoms. Next, we will dive into how CBT can be altered to help children and adolescents. Thank you.